My respect for detransitioners dwindles by the day, truly. Generally speaking, I think that folks who are detrans, like, I feel some amount of sympathy for them because I know what gender dysphoria feels like. And if you get a procedure done that gives you gender dysphoria, then yeah, I completely understand the fact that you feel dysphoria now. You know, I feel for you. And the journey of trying to go through and figure out who you are and truly self-actualize. Normally, I have a lot of respect for that process. The thing is that a lot of detrans people weaponize their regret in a way that then they then are trying to reduce trans people's access to this care. They're trying to introduce more gatekeeping, and that doesn't sit well with me. That's the problem that I have. For any of you who are going to come up in the comments, I want you to understand, detransitioned people who can speak about their own regret and don't make it about going after trans-affirming care and trans-affirming doctors, those people are fine. I feel a lot of sympathy for those people. I consider them to be sort of cousins to the trans community, right? My problem is with people who detransition and attack trans rights. And I also think, like, it's just good to clarify up the top here. If you are temporarily not on your medicine, or you are non-binary and you sometimes want certain kinds of care, but then later you decide you don't want that particular kind of care, but you still identify as non-binary, I don't really consider that detransition. Like, for myself as a non-binary person, sometimes I go on cross-sex hormones and sometimes I am not on cross-sex hormones. I've never detransitioned because I have always identified as trans through that whole process, right? So I'm specifically talking about people who, you know, think that they're trans or non-binary. They go through some kind of transition and then they decide that they're going to go back to identifying as cisgender and go on and on about, you know, their experience. I mean, not, you know, so some detrans people just go back to identifying as cis and they're fine and they're normal. Okay, those people are great. Today we're going to be talking about one of the ones who weaponizes their regret in order to attack not only trans people, but like the medical professionals who are providing this care. So we're going to look at a couple of things today. The first thing we're looking at is an article written by the detrans person. And it's possible that I've seen this person at one of those various town halls all over the place. Like, this might be one of the 3 detransitioners who gets flown across the country constantly. Camille Kiefel, I think is the name. I am not totally sure. We will find out. Or maybe we won't. I don't really care that much about pronouncing transphobic people's names correctly. So this person talks about being diagnosed with ADHD at 6 years old, which is that normal? Like, so this person is 32 years old right now, 32 years old in the year 2024. I really want you to keep that in mind. Okay. So first of all, like, I don't really know how the process went with, being diagnosed with ADHD at a very young age. It seems like 30 years ago, the standards were a little bit different. I don't know. Anyway, so this person says that she found out that her best friend was sexually assaulted by an older brother, and that's when things started to change for me. I started to present more masculine after that by wearing boys' clothes and identifying with male anime characters. I was trying to hide my body, my breasts in particular. This was in 6th grade, so this would have been like age 12, maybe 11, 12. Trying to hide my body by wearing baggy clothing. It wasn't until I got to college that I heard about the idea of being non-binary. It appealed to me because although I didn't want to be a man, I was having issues with being a woman. This in-between state allowed me to be who I thought I was. It felt safer to me, but I still felt like a bit of a failure when it came to my femininity. Interesting. And I mean, like, yeah, that kind of is one of the feelings of being non-binary, is like, I don't fit in with women, or I don't like being a woman, but I also don't perceive myself as transitioning fully into a man, you know? And I think it's totally okay. It's totally okay to be in like an in-between place, right? And identifying as non-binary also doesn't necessitate that you change your body in any way. I mean, identifying as binary trans also doesn't necessitate that you change your body in any way. But I think in particular, as a non-binary person, there isn't a clear from point A to point B. So there's a lot less expectation on you. You know, if you identify as a man, there is a very heavy expectation that you're going to get a double mastectomy and you're going to get chest masculinization done. You know, like there's much more of an expectation there. Hi, I'm Alexander and this is Mitternacht. You should hit the like button and subscribe and check out the Patreon. And ooh, look at this hoodie I'm wearing. It's merch. Check it out. Links in the description. Thank you. This person had a supportive family. The family were supportive and they did not give any pushback during the process of the surgery. This person says, I had been uncomfortable with my breast for a long time. So I asked my doctor about doing top surgery. So I just, like, that's something that I want to call attention to. This person sought this surgery out, right? It's not like the therapist recommended it. It's not like anybody pushed her, I guess, into it. Strictly, she asked for it. She had done 20 years of traditional talk therapy, 2 rounds of transcranial magnetic stimulation therapy, and I didn't respond well to medications. Yeah, I mean, this does sound to me like maybe trauma-focused therapy could have been helpful. Because like 20 years of traditional talk therapy, 2 rounds of transcranial, basically like that's like electrostimulation therapy, more or less. Not in the conversion therapy torture kind of way, but in the like, for people who have seizures and stuff, they get like direct cranial stimulation and not responding well to medications. It's entirely possible that this person should have done a trauma-focused therapy instead of traditional talk therapy, which just, you know, doesn't necessarily help with those specific issues. Ask me how I know. I've been doing traditional talk therapy for like 1.5 years, and I'm about to have to restart targeted trauma therapy because I have PTSD from my IUD insertion. So turns out just talking about your issues with your therapist doesn't help as much as doing like highly evidence-based targeted trauma therapy. So, you know, maybe this person should have looked into that. You can develop trauma from something bad happening to someone you love or someone you care about or someone you know, right? I think that there is a misconception that trauma has to come from something that happened to you specifically. But if you know someone whose house was destroyed during a tornado and you were worried that they may have died, that can give you PTSD, you know? So if you know, okay, my friend was sexually assaulted by a close family member, you know, that can affect you as well. So I would say maybe during that 20 years of talk therapy, some of the doctors you were seeing, some of the therapists you were seeing maybe should have suggested to you that, hey, look, let's say it's just been 10 years. If you've been doing regular talk therapy for 10 years and you don't get better, honestly, it's a little bit annoying to me that this person is suing the doctors who gave them gender-affirming care rather than considering that the 20 years of talk therapy was the malpractice. Like 20 years of talk therapy where you're not making any progress, the fact that nobody ever referred you to more targeted therapy, that's the malpractice. It's like when I was I had a doctor who was throwing drugs at me for 7 years, including stuff that you really don't want to be on, because I was just like, I'm willing to try anything. The fact that like 5 years into that process, she didn't say, I will no longer give you medication, you need to start therapy, that's malpractice. I didn't sue her or anything, but like I think that she mismanaged my care, or they did refer her to it and she declined to do it. Always a possibility. Yeah, that's a possibility for sure. So she says she was struggling, not able to work, and I needed something, but nobody was able to help me. I thought I was non-binary since 2016 at this point. I had surgery in 2020. Okay, so again, currently, this woman is 32 years old. In 2016, she was 24, and she believed that she was non-binary from the age of 24. She did not have top surgery until 4 years later when she was 28 years old. And like, honestly, like, you know, top surgery in like that sense of like, oh, you're getting a mastectomy, that's considered like gender affirming care. Yes. But also other types of surgery that are similar to that are done for cosmetic reasons. And it's just an informed consent process. And informed consent is someone tells you that there is a certain chance of you dying under anesthesia and your recovery is going to look like this, and your breasts don't grow back. Like, you know, there's an informed consent process. Anybody who's getting a breast augmentation, well, any cis person who's getting a breast augmentation, all they need is a doctor to say, okay, I had the conversation, she understands the risks, and we're doing the surgery, right? as long as she can afford it, presumably. And I really always think that it's so interesting when folks think that something like a breast reduction for a trans person or a breast removal for a trans person, like, why does that require anything? Like, why do you think that those people need a psychiatric evaluation, but a cisgender woman who wants the biggest breasts available to her, like, doesn't need psychiatric evaluation? That's the thing that I take issue with pretty frequently with this. So, and yeah, like, I will also say that for trans people who are trans, it doesn't matter how much talk therapy you get. It doesn't matter what crazy, like, transcranial magnetic stimulation you get or how many medications you're on. There are plenty of trans people for whom a procedure or hormone therapy is that, like, the fact that they didn't have that was the problem the whole time, you know? I will say that, like, yeah, there are some folks who, like, they really lack confidence because they have breasts and they're like, this is not matching with my internal sense of who I am. And every time I go out, people treat me differently because of my breasts. And then, like, their social confidence increases dramatically after they get the procedure, you know? So it's not like I don't think that there's anything necessarily to be read further into, I did all these treatments and I thought that top surgery was maybe the answer. Because for some people, it is the answer after they try a bunch of different treatments, you know? That's totally normal. I thought that removing my breasts or reducing the size of them would help me. I talked to my doctor about it, and he connected me with somebody through their medical system. That person connected me with 2 mental health professionals, one of whom saw me for 50 minutes and the other for 40. Okay, yeah, like, you told 3 health professionals that you wanted this surgery, and you explained your reasons, saying that I told them about my friend being sexually assaulted, oh, blah, blah, blah. You can't question trauma for being a reason why someone thinks they're trans. That's not an illegitimate reason. There are probably cisgender women out there who have gotten a breast reduction or a breast removal because of their trauma. That's not like an illegitimate reason. That's a perfectly legitimate reason to want your body to be changed. Although, again, trauma therapy is an available option. If this woman, she herself thought that her trauma might be, because, like, why would she tell them about her friend being sexually assaulted as a child if she didn't want to have that be part of the process? Like, she didn't want them to note that. So if you know that you have trauma, why are you not trying targeted trauma therapy? You could do prolonged exposure therapy. You could do EMDR. And those are just the 2 that I'm more intimately familiar with. There are other forms of targeted trauma therapy. There is something to say for adults making their own decisions, you know? Like, if you're 28, so you're almost 30 years old, do you expect a doctor to go, but are you sure, honey? Oh, are you sure? Now, so they're, you know, maybe you need to do another 5 years of talk therapy before we give you this procedure. Do you know what I mean? Like, how, like, do you want to be infantilized in that way? Do you want to be talked down to by a cisgender medical professional? Because the overwhelming majority of the time, it is a cis person who you're appealing to. And a cis person doesn't know anything about being trans. So they can't say, well, that sounds like you're not really trans. Like, or that doesn't sound like an experience of a trans person. Like, you know, do we want that? Do we want people with no training specific to the issue and no personal experience telling adults what they can and can't do with their own bodies? That's the question, because that's what this leads to. It leads to cis people with no specific training and no personal experience making these decisions on behalf of the adult instead of saying you are informed about the potential risks. Are there even any faulty studies linking trauma to a false trans identity in this way, or is this just a hand-wavy appeal that's meant to sound like a reasonable alternative? I'm not sure that there is any particular, I haven't looked into whether there are any studies on the subject of trauma as it relates to trans people. Like, how many detrans people claim that this happened because of trauma? Some of the most famous instances I can think of do not include any trauma. Like, Chloe Cole, is that her name? She doesn't invoke trauma as the reason why she thought she was trans. So even, you know, some of the most famous examples don't invoke that. Nobody showed me any research on the implications of doing the surgery. What do you mean implications? Are you asking, do you think that they should have showed you research on the regret rate? Because the regret rate is like less than 2% on these surgeries. Even people who have serious complications don't generally regret doing the surgery. And the weird thing too about being non-binary is, what do you even transition to? There's no non-binary sex to transition to. Yeah, of course. Yeah, I mean, I am a non-binary person, and that is a thing that I have struggled with in the past, is just feeling like there is no clear end goal. And honestly, that's a little bit freeing because there is no pressure. There was some pressure to me at a certain point because I identified with transmasculine people. And so I was seeing a lot of transmasculine people that I know getting top surgery. And it did feel at a certain point like, are people going to acknowledge my gender and validate me if they know that I have breasts and that I don't want them removed, you know? And even now, you see the camera angle, you see this baggy hoodie, like, I don't show off my breasts for the most part in these situations where I'm talking specifically about being trans, because, I mean, yeah, I think that people undermine the legitimacy of non-binary identities when you don't want to surgically alter your body in that way. I do want to surgically alter my body, just not in that way. But yeah, but, you know, there's a kind of freedom in there not being a roadmap, because it's not, I don't feel this like, oh yeah, I need to tick this box and then this box. I'm like, look, I took hormones and it changed my body in certain ways, and I'm very happy with that. And I'm not the kind of person who feels like I need to be on hormones for the rest of my life. And I am not the kind, I don't feel like I need to do any particular surgical procedures, like, because I'm just being me. I'm gonna get the procedures that I want, hopefully, and not be concerned with the fact that I'm trying to embody what being a non-binary person really means. And I think that for trans people who are binary, there's this feeling like, oh no, I'm never gonna be a real man or woman because a man or a woman is a very specific set of ideas, right? I don't know why people don't see that as more freeing of being non-binary, you know? Both doctors and the surgeon approved of the non-binary top surgery. I don't think the surgeon had ever done a non-binary top surgery before doing it on me. Was your procedure different from a normal mastectomy? Like non-binary top surgery, I don't know what that means exactly in this context. Sometimes it means like you don't have a chest masculinization, in the sense that maybe they'll put your nipples in a place that it's not supposed to look like a cis man's chest. I don't know. Anyway, she says, I felt like I was trying to escape something at the time. I was really struggling. Okay, well then, like, again, there were more answers than just this. You are an adult. You have the ability to look into trauma therapy, and the regret rate of this procedure is very low. So, like, why would it have even helped if anybody told you, like, are you sure? Maybe you'll regret it. Do you think you would have changed your mind? Right after the surgery, I developed a lot of health issues. I wasn't sleeping through the night. Yeah, going under general anesthesia can do that to you. I started bruising easily. I had constant skin discolorations and heat rashes. I am not sure what that is about. But you got this procedure in 2020, so you could have gotten COVID, and COVID can cause some weird shit like that. When I spoke to my doctors about this, they put me on sertraline, and I ended up developing a rash because I was allergic to it. The doctors didn't know what to do, so I was advised to keep taking it. It was horrible. I don't know what sertraline is. At that point, I feel like I needed to figure out how to get better. Since the Western conventional model wasn't helping me, I saw a naturopath. I started eating meat again. I saw practitioners who did body work and hyperbaric oxygen therapy. Fascinating. Those procedures really stabilized me. That's what I needed, and not surgery. I felt a lot better because I came to terms with my trauma. I realized that believing I was non-binary was a coping mechanism for me. Okay, again, valid but vanishingly uncommon. When you believe you're something you're not, you really hold on to that. Yeah, again, if anybody had told you that maybe you weren't non-binary, would you have believed it, or would you have just stopped seeing that doctor? Oh my God. In order to transition back to my original sex, I started dressing a little bit differently. It's a difficult situation for me because I can never get my breasts back, which has been hard. So I know somebody who got cancer at the age of 26, breast cancer. They have the BRCA2 gene. So they had breast cancer, and they had their breasts completely removed, and they were flat, right? And then they had a second procedure done to get silicone implants. So yes, you can, sertraline is an antidepressant. Okay. So if it's possible for people who've had a mastectomy for cancer, which removes more tissue than a masculinizing mastectomy, because you're trying to remove all the potentially cancerous tissue, right? If a person who's had cancer and a mastectomy for that can have reconstructive surgery and have silicone implants put in, why can't you? It's not impossible, actually. And this thing, it's like really upsetting to me that like it's routine. It is routine. It's covered by insurance for a cisgender woman to have reconstructive silicone implant surgery after her breast removal. And like this dopey ass person is so fundamentally unaware and is so trauma brained and is like so doomer about this whole process. Like, I can never get my breasts back. I don't think I can ever fit in a dress the same way again. Like, okay, yeah, it won't be the same, probably. It's not going to be your same breasts that you were born with or that you developed in puberty, but you will definitely, you can get silicone implants and dress in a dress and look normal. I don't want to show pictures of my friend on the stream because this has nothing to fucking do with them, but my friend makes their own dresses now. They fit beautifully. If I didn't know that they had had a mastectomy and then reconstructive surgery, I probably wouldn't be able to tell, you know? Like, so I just think that this is fucking annoying. I don't hear people talking about the process of detransitioning too much, but I know that you do know that you can get implants. But for some reason, that's incompatible with the idea of fitting in a dress the same way again. Oh my God. It has impacted my dating pool. Sure, I'm sure it does. I'm speaking out about this because I'll have to live with my body being mutilated for the rest of my life, and I don't want this to happen to others. You are 28 years old. You made an informed decision. I don't know what you expected. I don't know what you wanted. You had been going to therapy for 20 years. What did you expect? How many more doctors do you think people should see? I want doctors to know that they need to look for underlying health issues and realize that there's no non-binary biological sex to transition to. So this person, I think, has now come full swing out the other direction into, I don't think being non-binary is real. Like, what? I'm sorry. Like, I know several people who were born with a vulva and who now have a vulva and a penis. Yes, there is a way to transition to being biologically non-binary, actually. I know somebody who wants to have a mastectomy for one breast and keep the other. Yes, it is possible to transition into a non-binary biological sex. I hate these people so much. So this woman is suing her doctors. And that's the reason that we're really talking about this today, is that she is an adult. Plaintiff experienced severe childhood traumatic events leading to her feeling discomfort and dissociation with her body, diagnosed with ADHD, CPTSD, major depressive disorder, and generalized anxiety disorder. These mental health conditions proved treatment resistant despite nearly 2 decades of psychotherapy and prescribed medications for these issues. Plaintiff had to stop medications because of serious side effects. Plaintiff also suffers from PCOS. Okay, so you're intersex. Okay. This person also had regular episodes of suicidal ideation. Plaintiff began to identify as a non-binary gender identity and described to therapists a feeling of distress or dysphoria regarding her breasts. Again, I don't know what you expected to happen. Feeling as though she had tried everything to help her mental health issues, plaintiff came to believe that breast reduction or removal would finally solve her mental health problems. I will say that you probably shouldn't look at transition as a way to solve your mental health problems. They can alleviate it, or they can help take the weight off. But typically you're dealing with more than one thing, right? So yeah, maybe specifically trauma therapy would be good. Yeah, the idea that you cannot be biologically in the middle. I have to be very careful talking about this because I also think, for example, I took testosterone, I made my voice deeper, and my genitals changed, and I think that on its own has made me non-binary in a sex sense. I am biologically non-binary. But there are plenty of trans men out there who have only been on testosterone and have not had surgery yet. And I don't want to try to I don't want to point at their bodies and say, look, they are biologically non-binary, because I just think that that is rude. I'm only speaking about my experience and my body, right? Yeah, doesn't believe in non-binary genders, is literally intersex. Yeah, for y'all who don't know, polycystic ovarian syndrome, which is PCOS, is broadly considered to be a disorder of sex development, which means an intersex condition. It's a hormonal condition where you have more testosterone in your body than most cisgender women. And it can cause fertility issues. It causes people to grow facial hair. Like, it's an intersex condition. So if you have PCOS, you are intersex. Like, you can still identify as a woman. That's fine. You can be an intersex woman. But like, yeah, the idea that you cannot be, quote, biologically non-binary is just really silly. Okay, how long was this process, I wonder? So in 2020, early in the year, she said that she wanted to pursue top surgery. In May, she got a referral from one doctor in May. She got a referral from another doctor in July. She got a referral from another doctor also in July. So not only did she identify as non-binary for 4 years, but she spent several months seeing multiple different doctors, telling them all that she wanted this procedure. Like, again, this is another thing that we've talked about before. We had a segment a while ago about a woman who defrauded her insurance company by claiming to be trans and like having them prescribe to her testosterone. And she filled that prescription, by the way. She defrauded her insurance company by lying. Like, what do you expect if you tell multiple doctors that you want this procedure and you've already been seeing a therapist for a long time? Like, I think that the end goal of this is to make this care like no longer an option, completely off the table. I think that they're basically like, I don't know what additional gatekeeping you could possibly expect. Like, do you want all 3 of these doctors to give you like 6 months of therapy? Yeah, terrible doctors, exactly. How dare they listen to their patients and respect their feelings? A cisgender woman can go to the doctor and say, I don't like how heavy my periods are, and then with no other hormone testing or anything, she can be given estrogen therapy, right? A woman with PCOS who wants estrogen can just get it. But we expect, and like also, again, a cis woman who like has back pain and wants a breast reduction does not need psychological assessment to do that. A cis man who has gynecomastia does not need a psychiatric assessment in order to get a complete flattening procedure done, right? Well, I'm sorry, this is just so dumb. The plaintiff's dysphoria about her body centered on her breasts and hips, for which no, quote, gender affirmation surgery is possible. I'm sorry. Yes, there is. It's like the opposite of a Brazilian butt lift. They take fat from your thighs and ass and insert it into the trunk area. You know, typically, like, females, like, broadly speaking, have this, like, hourglass thing that happens where it's like they have their rib cage and then their waist goes in a little bit and then their hips come out. There is a masculinizing procedure. I'm sorry, this is just so fucking dumb. There's a masculinizing procedure that takes fat from your ass and thighs, because like the other thing that people get dysphoric about is the fact that like their hips are so big and their ass and their thighs are so big. You can take it out and you put it into this area that normally is coming in like this, and it makes your entire figure more like square. Just don't say untrue stuff in your lawsuit. Oh my God. But a lawyer wrote this and the lawyer doesn't know. Oh my goodness. So yeah, basically this person like learned what to say in order to get the procedures done and either genuinely believed that the procedure would help or lied to get the procedures done. Repeated this story to multiple medical professionals who, again, like, what do you expect them to do? Do you expect them to go, yeah, but are you really? Yeah, but are you lying though? Like, that's not how this works. That's just not how any of this should work. Surgical body modification is highly experimental for non-binary people. No, it's not. The plaintiff has mental harms, including distress and anguish regarding her lifelong inability ever to choose to breastfeed a child. Bro, guess what? There are plenty of cisgender women who have breasts who can't breastfeed because it just doesn't work for everybody. And you know what the solution to that is? Getting a supplemental feeding system. There's this thing that you can get that's called a supplemental feeding system where you can breastfeed. You basically like you like tape this tube to your body, and this is like for women who don't lactate enough or women who can't lactate at all. It's, you know, like, again, like, just do some bare fucking research. This is the thing that I always say about detrans people. You would be so much better off if you just stayed friends with trans people, because we have all the answers. If you think, oh, I transitioned too far, I'll never look like a blah, blah, blah. Like, oh, I lost all my hair, or, oh, I'll never be able to do this. Like, just talk to trans people. We will tell you how to regrow your hair. We will tell you how to breastfeed a baby. Like, oh my God. You are alienating the only group of people, apparently, who have the answers to help you realize the goals that you have in your life. Like, you have this goal to breastfeed a child. Well, guess what? I have the answer. Fear and anxiety over finding a life partner sexually and romantically attracted to a woman without breasts. Okay, fair enough. Mistrust in mental health professionals. Well, you were seeing a therapist for 20 years who didn't help you either. Daily life anxieties, such as no longer being able to fit well into dresses, and like get reconstructive surgery, or just wear, like, what are they called? The chicken cutlet things, the like silicone implants. You can still function. Like, life is not over for you. But this is a person who is deeply mentally unwell. And I want to say that too. Like, this person is deeply mentally unwell and has been for a long time. And it was a similar thing with that one balding detrans person that we talked about a while back, Casey Miller. These people are deeply mentally unwell, and gender transition was not going to help them anyway. And now they can point to the gender transition that they now regret as like the source of all their problems. But like Casey Miller also was purchased as a baby, not adopted properly through proper channels, but purchased as a baby. So they also are against adoption, even when it is done through the appropriate channels, because they were trafficked. Like, because they were trafficked illegally, they're against legal adoption. Okay, these people are not mentally well. Like, and I don't mean all detrans people, to be clear. I mean these specific instances that we are discussing. This woman, yeah, they sell pocketed bras that you can put the chicken cutlets in, the silicone breast forms. Yeah, thank you for going along with my little joke there. Yeah, like these particular people who are like, I had issues for years and years and years and years and years and nothing was working, and I decided maybe being trans was the thing that was actually wrong with me. Like nothing but very targeted specific treatment was going to help you in the first place. But like, I don't know how you can call this malpractice if they're following the procedures, they did as much due diligence as was possible. You have presumably been seeking mental health care for most of your life. You know, like, I don't see what the goal of this is other than basically trying to make this impossible for anyone to access anymore. One of the things mentioned here is that the doctors allegedly violated a code stating that counselors take special care to provide proper diagnosis of mental disorders, using assessment techniques including personal interviews to determine client care. And they misdiagnosed plaintiff with gender dysphoria or gender identity disorder. Again, we can't do brain scans on people to determine whether they're really trans. We do this by asking them questions. And if you lie and state that you have all of the things under the diagnosis of gender dysphoria, that is your fault. Or if you mistakenly believe that you have those issues, like, that is still your fault. That is not the doctor's fault. The doctor could not possibly have done any more due diligence with you. Yeah, I know. I'm talking about this as though there is a good reason for it, other than like these public detransitioners are trying to get paid. You know, like, what other reason could you have? Like, well, you're trying to sue the doctors and have them pay you. And I guess it's worth mentioning again that this person has not been able to hold down a job and is on disability. So getting a payout in this way would probably be great for her. Like, yeah, if she's unable to work, then making a career out of lying about her doctors probably is a great way for her to make sure that she's going to have a future and like be able to pay her rent and make money. I'm trying to figure out if there is anything that they want. Okay, so the plaintiff sustained physical, emotional, mental, and psychological injury that caused and will continue to cause serious pain, anguish, distress, discomfort, physical impairment, inconvenience and interference with normal and usual activities, and ability of plaintiff to perform major life activities. Girl, you couldn't perform major life activities before this procedure. All to the plaintiff's general damage in an amount to be decided by a jury and not to exceed $500,000. As a further reasonably foreseeable result of the defendant's professional malpractice, plaintiff has incurred and will continue in the future to need to incur necessary costs for medical, psychological, and therapeutic treatment in a reasonable amount to be decided by a jury and not to exceed $250,000. Plaintiff has suffered wage loss in an amount not to exceed $100,000. Girl, again, you were disabled. You did not have a job. What are you talking about? Lost wages. What do you mean? Yeah, this is they just want to pay out. They really just want to pay out. Transitioning interfered with my awesome life, says a person who was in therapy for 20 years. Yeah. Additionally, feelings of betrayal by mental health professionals, humiliation, distress, and anxiety over having lost her breasts, permanently scarred and disfigured, permanently losing her choice to ever breastfeed a child, being unable to fit properly in dresses and clothing designed for women's bodies, all to plaintiff's non-economic damages in amounts to be decided by a jury not to exceed $500,000. Plaintiff suffered and still suffers injury and harm directly related to this, including physical, emotional, psychological stress, all to plaintiff's non-economic damages in amounts to be decided by a jury not to exceed $500,000. So yeah, basically she's trying to get like a couple $1,000,000 payout. Like at minimum, like there was like the economic damages and non-economic damages. I think that she's trying to get like $1,000,000 payout for this. I don't think that she's pursuing like any kind of, oh, this person shouldn't be able to practice medicine. But if you sue a doctor and they're liable for like $500,000, that could easily put them in a situation where they can't practice, like, or that they could lose their house or something. Like, the whole process of taking people's money. So yeah, an adult human female who made informed decisions about her own health and who told the doctors that she wanted this procedure repeatedly over the course of at least several months. Is there an additional burden of proof for seeking anything above $500,000? I think that it's like limited in the law that if you are trying to sue someone for certain damages, you can only sue them for a certain amount of money. It depends on where. Where is this? Is this in California? No, this is in Oregon. Right. So this is being filed in Oregon. The total amount, I guess the total amount that she's asking for is $850,000. Yeah. Again, why is your issue not with the fact that you were in therapy for 20 years and that apparently like didn't help you? Why are you not upset with those therapists? You're upset with the therapists who you specifically asked to give you a letter of recommendation for surgery. I think that honestly, part of this, and the fact that so many of these detrans stories focus on young women, I mean, she's not even a young woman, she's fucking 32 years old. So many of these stories focus on women because there is this infantilization aspect. There is this aspect of, oh, well, she couldn't have known better. And oh, look at the harm that the doctors did to her. She's such a victim. So ultimately, this particular aspect of the detrans narrative is just straight up misogynistic. I mean, girl, you're trying to get a payout on misogyny. Let's be honest here, therapy requires an amount of personal accountability that doesn't sound like she has. I mean, that's true enough too. Traditional talk therapy, does that mean that you weren't doing evidence-based therapy? Was the therapist telling you you need to do certain homework? You need to do certain things outside of the therapeutic session? Is there an expectation that you need to like do anything? It seems like this person is a perpetual victim. Like, she refused to work for years. She did not figure her shit out. She was on disability for mental anguish problems. Like, people with ADHD do have, like, okay, I have ADHD and possibly PCOS, and I've been diagnosed with ADHD. And, I said it twice. That's ADHD for you. So yes, I have been independently diagnosed with ADHD 3 separate times. I'm probably autistic, but I have not been officially diagnosed. I have PCOS. I have PTSD and complex PTSD, which has been resolved. I've been diagnosed with borderline personality disorder. And here I am. Do you see me? Here I am working for myself. In fact, it is hard to get a job and sustain a job. And I tried, and I also have physical disabilities. So I actually have more going on than this woman does, because I also have POTS and a mixed connective tissue disorder. So I actually have more going on than this girl. And again, yes, working for someone else is physically difficult for me because I overheat and my heart rate gets all off the charts and everything. But yeah, I mean, like, what have you been doing? I'm 30, she's 32. Like, what have you been doing this entire time? Or listen, this was actually filed in 2022, and it says plaintiff is a 32-year-old woman. She's 34. Earlier this year, an article was posted saying that she was 33. So she was actually closer to the age of 30 when she had this procedure done. So she was my age when she had her top surgery done. Again, what do you expect to happen here? What additional gatekeeping do you want? Like, the number of detransitioners is like fewer than 2% of the 2% of the population who are trans. So why are you going to listen to the 2% who regret their shit versus the 98% who wish that there were fewer barriers? This is the thing. Trans people are never consulted when we're setting these standards. I guess the president of the WPATH is a trans woman, but like, overwhelmingly, most trans people never get a say. Most of the doctors involved, the therapists, the surgeons, the insurance companies, most of those people who are deciding whether trans people get care, not trans, they're cisgender. Imagine if you actually prioritized the group who is most affected by these issues. But yeah, Camille, she just wants money. Camille wants a payout. Camille is not interested in helping other trans people or other detrans people. She posted in this little article, I also do a bunch of advocacy, trying to help other detransitioners. We started this group called Detrans Help. And like, yeah, probably a lot of detrans people don't want to work with you because most detrans people are not transphobic. They're not suing their doctors for the informed decisions that they made at the age of 30. The age of 30. I can't imagine getting a procedure now and being like, the doctors shouldn't have let me get this procedure. I did get an IUD placed, and she deliberately did not tell me what the details of the procedure were. And I think that's a totally different thing. And like, I was awake and fully present for having my internal organs yanked around by a claw. That's, I think, a different situation. And if I had been informed about what the procedure entailed, I would not have gotten it. But with top surgery, it's like, okay, we're going to put you under general anesthesia and we're going to, they make the markings on you while you're still awake. They're like, okay, we're going to cut here and then we're going to move this skin here and we're going to do the nipple grafts. And okay, all that happens while you're awake. So it's as informed as it can possibly be. And if only 2% of people regret it, why would they tell you, well, maybe you might regret it? Like, girl, excuse me. Yeah, the detrans subreddit is full of TERFs. So much so that like actual detrans people who just need support, they had to create a totally different subreddit, and they speak privately about their issues and they speak about it in secret because TERFs and other transphobes will take these stories and blow them up and say, look, point at this girl or point at this guy and say, look, they weren't informed or whatever, like they regret it. Look at this. Most of these people don't want their stories to be weaponized in this way. It's such a bummer too, because these people even restrict access ultimately to trans people. Like, if you know that if you post a picture of your healing genitals to a trans space, that there is a good chance that some TERF will steal your images and revenge porn post them on their public Twitter. And those are your genitals. Like, it's revenge porn. It's a crime in most places. And to know that like they're going to talk about your body in that way, you know, if I ever got bottom surgery, that is a big thing that would prevent me from ever posting any details or any photos. Like, sure, let me start charging $100 per month on Fansly, and then you can see. It reminds me of people who don't like their nose jobs and then go online saying all cosmetic surgery should be banned. I think most people who, okay, so I'm pretty sure it's like a majority of people who get nose jobs end up regretting it later. And most of those people don't go on and say no one should ever get a nose job. Oh my God. Okay. I've been talking about this for forever. This is one of the longest segments I've done in a while, it feels like. And I don't know if there's anything else I can say. It's just, this person is clearly grifting. Like, you couldn't get a regular job. You were too emotionally fucked up to keep a regular job, apparently. And, like, you're clearly unable to work for yourself. This person, do you even have any monetizable hobbies? Why don't you pick up knitting? And then maybe you'll have, like, a source of income that isn't being a complete moron. Anyway, I'm not very nice to people like this, and I don't really think I need to be. I think if you are trying to advocate that there is no such thing as transitioning into a non-binary person biologically, like, yeah, you're taking a transphobic position. You're no longer speaking about your own regret. You're now speaking about other people and what other people should do and what is possible for other people. Like, you simply lack imagination talking about mutilation when it's a procedure that you asked multiple doctors for. Anyway, like and subscribe. Happy Pride to my patrons, especially Tiago Nascimento, Mersh Rolvog, Jack, Amanda B, Wellington Marcus, Michelle Frateroli, Michelle Winter, Danielle McDonald, Jamie Jam, DZXN, Nova, Sojo, Athiet, Spooky Heather Sylvia, Desi Quiche, Pasnell Infinity, Celeste, Kevin Young, Elizabeth Bartell, Liam Hodgson, Ella V. Nobody, Mr. Atheist, and Suzanne Maynard.